Welcome, Dr. Alyssa, to the Root of Our Health. It is such a pleasure to have you on this podcast.
Thank you so much for having me. I'm very excited to share with your audience and address issues that really are on the top of everybody's mind.
Yes, I can't wait to dig into them. But first, let's get to know you a little bit. So what is your background? Why did you get into gynecology?
Right. So I am a traditionally trained OBGYN. Excuse me. I love gynecology. And actually, I should back up a little bit and say, I trained in OBGYN because I love drama. And I'm always drawn to wherever the excitement is. So there is no better excitement than in the obstetrical world. So that's part of it. The other part of gynecology that I love is that I really can relate to so many of the issues that I see with my patients. I'm a woman. I've gone through many of these stages of life. I feel like I have an acute understanding of that, like so many of us gynecologists. And so that resonates with me. And lastly, it's a great group of people. We tend to be, pretty excited and excitable. So I think the people that trained me and the people that I work with really make it a wonderful career.
Beautiful, beautiful. And how long have you been doing this as a
I've been
profession?
I've been in OBGYN probably about 28, 29 years.
Okay.
About 6 or 7 years ago, I decided I did relish my sleep just a little bit more. So I gave up the obstetrical portion of my practice. And now I really focus on gynecology. I focus on menopausal health. I focus on sexual health and outside interests as well. But it always seems to come back to gynecology with that too.
Yes, definitely very needed, in this day and age. So that's awesome. And I love how you put like the drama part of it too. So thank you for sharing, first of all, your background and how you got into it. I just want to start by talking about vaginal health. So what is it to have a healthy vagina?
Yeah, so I always like to frame this by really stating that the vagina is an incredibly special organ, place. It has mechanisms to keep itself healthy, and it's up to us to make sure that we don't expose ourselves to too many disruptors that get in the way of those natural processes. So, for example, the vagina has its own microbiome. As you well know, and I'm sure your audience knows well, the microbiome of any environment really contains a lot of different organisms that naturally live there and are in a very delicate balance, keeping things healthy. The vagina has bacteria called lactobacilli in many strains, and these strains are actually pretty unique to different people and communities, but nonetheless, the entire group of bacteria called lactobacilli are super helpful because they produce lactic acid and hydrogen peroxide to keep the vagina in a normal acidic pH. This wards off infection like BV, like yeast. It also wards off symptoms, itching, discharge, unusual odor, that type of thing, keeping things very comfortable. So many of our day-to-day practices get in the way of this natural microbiome and disrupt the pH, whether it has to do with sexual practices or sex in general, whether it's hormone changes, whether it's medications, stress levels, you name it, it tends to have an effect on the vagina. And so this is what's meant by a healthy vagina. Things are all in check and in harmony together.
Beautiful. And yes, I talk a lot about gut health. So the microbiome in the gut. And we don't often talk about the microbiome in the vagina. And it's a huge part of women's health. So talking about it, I think is definitely key, and understanding that it's similar. We
Oh,
need to keep,
absolutely.
it needs to be, I don't want to say detox, but it just needs to be flushed out to where there's good, it's just balanced, right? Like you said, the pH balance in there. So
Absolutely. So I actually do talk about the vaginal microbiome every day, all day. So welcome to my language and to my day. But, I'd like to distinguish the vaginal microbiome from the gut microbiome, which I don't know quite as much about. I mean, they work similarly, but the vaginal microbiome specifically, causes, if it's disrupted, causes symptoms that really affect women's self-esteem, their confidence, their physical comfort, their emotional comfort, their day-to-day work efficiency. So, that's my world, and it's my job to try to help people keep their biome in the vagina in a good place.
nice. Yes. I mean, once we have, again, when you're talking about the itching and the uncomfortableness, it can disrupt our day because it's like, oh my God, I feel, or odor. You're going out in the world and you just have this odor and you're like, what am I doing? What do I do? And
Yeah.
so yes, your help will definitely, make it better.
And so many women come into my office, and there's a very big distinction between odor and scent. So all vaginas are going to have a scent.
Got it.
Scents may change throughout the cycle, and I think women just need to accustom themselves with that and know if something goes awry. An odor suggests that something's not right. It suggests that there might be an infection, there might be some sort of disruptor going on. So I do like to make that distinction.
Got
Our
it.
vaginas are not supposed to smell like a flower bed. So
No matter how much we try, right? We're putting things on there that's probably just, bad or worse for it. So just let it be, let nature take its course and take care of it. So that's the best part.
sure. And I'll just pass on a couple of helpful tips that I
Yes,
generally
please
pass
do.
on to my patients. Yeah. So, there are probiotics for the gut, as we all know, but there are also specific probiotics meant for vaginal health. And these contain the type of lactobacilli that are specifically geared towards a healthy vagina. One probiotic that I have, intimate knowledge of, because I work with the company that makes it, it's called Claire V, contains specific lactobacilli as well as a prebiotic to help maintain the viability of those lactobacilli. And there is science and research behind this particular probiotic to show that these strains, when taken orally, get to the vagina, their target organ to work. But little lifestyle tips that you mentioned before that are so important. Sexual activity can impair or disrupt the vaginal pH. So it's important to, use a condom if you're somebody who's prone to infection or who has multiple partners. We also know that various products like douches, for example, no matter what they contain, may disrupt the vaginal microbiome and need to be mitigated if problems are arising. Antibiotics are the most notorious disruptor of the microbiome, and so precautions can be taken to prevent infection. These are just a few. Hormone changes, so pregnancy, but also oral contraception or other hormonal contraceptive efforts can sometimes disrupt the biome. So these are all things to think about when we talk about a healthy biome.
Thank you. Yes. Everybody get your notebooks and pens out because we need, yes, that's great, great notes. And I'll actually put this also in the show notes. So it's, in list form so people can just understand, the tips that you just gave. Thank you.
Of course.
Perimenopause. Okay. So before we get into the menopause part of it, perimenopause, first of all, does every woman get perimenopause or is in or perimenopause, and what are the symptoms?
Yeah, so let me just clarify a few definitions because I
Please.
note so much, real misinformation out there.
Yeah.
Menopause is the day and time that is absolutely inevitable. Okay. So just keep that in mind. But it is the day and time when 12 months consecutively have gone by without having a menstrual period for no other reason other than menopause. Perimenopause often takes women by surprise because they're not expecting it, and because it can last for a long time, and because the symptoms can be somewhat vague or just there's a little bit of a disconnect as these symptoms start. So perimenopause is defined as those numbers of years. It could be even up to 4 to 10 years where hormones are a little bit volatile and things are changing. And this is the lead up to menopause. Probably the most common initial symptom is a change in the menstrual cycle, whether it's a change in the bleeding habit, the duration of flow, the amount of flow, the quality of the flow. So these are things that women will often notice, or skipped periods from time to time. But these things wax and wane over time, and they also might need to be checked out to ensure there's no other medical issue going on before we blame perimenopause. But that is the period of time you're speaking of. Other things that may come about that, again, people may not recognize at first until they think about it or hear this information on your show. Hot flashes that come and go a little bit, night sweats or difficulty with sleeping, quality of sleep. The one I think I hear the most are mood fluctuations and irritability, where women come in and just tell me, Dr. Dweck, I have absolutely no idea who I am sometimes. My mood is so volatile because I feel irritable. I have no patience for things that I used to have patience and tolerance for. In hindsight, much of this is the perimenopausal change because hormones are changing.
And what in perimenopause, so is it more estrogen dominant? Like what are the hormones that play a role in this?
Yeah, estrogen predominantly is becoming volatile. So rather than having that strict, orchestration of ovulation, estrogen release, and then progesterone increase, things change a little bit with estrogen, which is not necessarily being released as much as it was. It may be an irregular release. Therefore, progesterone changes. And the other change that comes along is in the testosterone ratios. So it's mostly estrogen, progesterone, testosterone, and the ratio of the three of them amongst each other.
Got it. Thank you for clarifying that. That was a off the cuff, question, just because I was interested in that.
Yeah.
So going from then, obviously the perimenopause is before menopause, and menopause, how old usually are we when we get menopause? And if you can go into why do women have such a hard time with menopause? It just seems like it's such a drag.
Yeah, well, I would like to hopefully reframe that right now, but
Please.
a couple of things. The average age of menopause in the US is about 51 and a half.
Okay.
But that means give or take a couple of years on either side. The years of perimenopause are the 4 to 8 years or 4 to 10 years approximately leading up to that. So technically it can really start in the late 30s, early 40s, but again, may not be that easily recognized. There are so many inputs and associations with what the menopausal experience is like. Part of it is genetic. So if your mother had a miserable menopause, it is possible that if your lifestyle is somewhat similar, that you will follow suit. So go blame your mother for that. You may get a window into time with sisters or other family members, but oftentimes a lot of us are speaking with our work cohorts or our friends. So we're hearing a lot of different experiences. I'd like to really frame menopause as something that has a lot of positive aspects. So for example, you don't have to consider contraception at the time of menopause because you can't get pregnant any longer. So that's something that is a positive for some women. On the flip side, some women feel a little unhappy or thoughtful about the fact that their fertility is no longer present. So that's something to consider when it comes to how people face this. Symptoms can vary based on lifestyle habits. So for example, smoking. Smoking is something that has been shown in a big study called the SWAN study to really make the symptoms worse. So you may go through an earlier menopause if you smoke, and you may have worsened things like hot flashes or night sweats when you smoke. So that's something that's a modifiable variable. As far as other lifestyle things, ethnicity does seem to play a role. So it seems that our African American and Hispanic population has a slightly more notable duration and intensity of hot flashes and night sweats than the Caucasian or Asian counterparts. So that's just something that could be lifestyle related or truly have a genetic ethnic component. We know that diet and exercise have a lot to do with the experience. So those practicing like a Mediterranean style diet might have an easier time, while those, high in salt, sugar, junk food, spicy foods, and that type of thing may have a harder time with hot flashes. So these are just a couple of examples. Glad to go into more detail if you like, but they all have an interplay. Lastly, medical conditions. So if you're dealing with other medical conditions or medications for them, they may play a role in your experience. So again, trying to optimize general health is going to be helpful.
Yes, yes. And what you listed off is basically this podcast, right? Lifestyle changes.
Yes.
This is something that we are trying to, or I am trying to get out in the world, that, you have control over your own health. And if if things such as, let's change our diet a little bit, let's change, the exercise, in knowing that this will help your symptoms, and you don't have to go through menopause in such a horrible way, I think that will hopefully get women to realize, okay, well, it's not too late, right? It's not too late. And let's see how we can reverse this. And so our our menopause doesn't have to be so grueling and so,
Sure.
hot flashes and just, ugh.
Agree. Well, you know what? It's never too late. So I'm really
Right.
glad to hear you say that. The lifestyle issues we can modify, the ethnicity and the genetic factors we possibly can't. And of course, I have a war chest of pharmacologic options or herbal options or other, medications or even certain surgical procedures that may be helpful for some people that we can also use as adjunctive, but lifestyle comes first. And I want to make a big plug for something that you probably talk about with people every day, all day, which is stress reduction, especially over the last couple of years, because we know that there are certain triggers to some of the awful symptoms that associate with menopause, and stress is one of them. Stress is one of the biggest factors in bringing on hot flashes and night sweats and interrupted sleep. So again, for stress reduction, whether it's exercise, whether it's some sort of meditation or yoga or a simple app of meditation like Headspace or Calm, if you're so busy during the day that you can just take a 10-minute time to do this and de-stress a little bit, it may help your cause. I also feel like preparation is key. So thankfully, there's a lot more information and a lot more conversation going on now about the menopause experience so that women have time to prepare. In other words, it's never too late to start a reasonable diet, but it's even better to prepare yourself 10 years in advance so you're hopefully heading off some of those symptoms at the pass. So yeah.
Yeah, no, that's wonderful. And first of all, you spoke my language by saying stress management. I mean, that's my wheelhouse. And so I understand how reducing your stress actually impacts a whole host of things in your life, because your hormones are in play when you're stressed, right? So again, we talk about the estrogen dominance, we talk about the imbalance of your hormones, not just your sex hormones, but steroid hormones like cortisol.
Yeah.
So everything plays a part. And if things are imbalanced, that's when you get the symptoms like hot flashes and all of that. So yeah, stress management is number one. And no, it's never too late. And that is something that I have actually, because I'm turning 45 in a couple months. So I'm just like, okay, I know it's coming in like 5 years. What can I do to minimize, minimize the symptoms, minimize the, just control what I can't, or, control what I can't control, right? And change what I can't control, excuse me. And that's what I try to tell people, my audience. They're not all going through menopause. There are some, even in their 30s, some 40s. So going into, the this life, the part of life, understanding how can we take control now? What can we do now? And then this way, when it happens, it's a beautiful thing, right? And I get it, psychologically, you brought it up. Some people don't want the period. Thank you, goodbye. Some people, it's like, well, now I feel less of a woman.
Well,
So
you bring up such a good point. And so the third reason that I think menopause is difficult to approach right now, which thankfully I think is changing a little bit, are the social norms and the taboos that have been out there for such a long time about this stage of life. In past, like in my mother's generation, or probably in your mom's generation, this was something not spoken about. You have to either suck it up, go back to business, or go hide under a rock somewhere until it's more tolerable and more manageable. But that's not the case anymore. And I think so many professional women want to remain incredibly productive and efficient in their work lives, especially as maybe if they have children that are now slowly leaving the nest, they can finally focus on their professional lives, and they want to feel at the top of their game. So to give hope out there, lifestyle changes are awesome, and they do work, and they work over time, but there are treatments, and they don't necessarily have to be heavy duty hormone treatments, although that's available and it surely works. But I find that there's a big camp of women these days who are really focusing on the natural, non-hormonal herbal options for their menopausal journey. So I'm finding that that's become much more popular, and things that people want to try first in an effort to mitigate symptoms.
yes. And so let's go into that then, the
Yeah.
hormone replacement therapy. I hear, conflicting things, and it's a hot topic. HRT is the best, and then like you said, lifestyle, or so to you, what is, you gave it out, lifestyle and herbal, but what is also your thinking about HRT, and who should get it and who doesn't have to?
Sure. So HRT works 100%. I'm not going to sugarcoat that. But it comes with some baggage that's possible, and it is not appropriate for everybody. So the bottom line is that hormone replacement typically includes estrogen in one form or another, whether it's a tablet or a patch or a cream or a gel. And I'm speaking about systemic hormone replacement therapy right now. It is an FDA-approved medication in whichever form, meant to mitigate hot flashes, night sweats, vaginal dryness, and even protect the bones from osteoporosis. And it works quickly, and it works well. However, there were studies done quite some time ago, and I'm not going to get into too much detail, and there were limitations with these studies, but nonetheless, they showed a potential increase in breast cancer, uterus cancer, and cardiovascular event in certain regimens. And this caused the prescriptions for hormone therapy to plummet at that time. And it's been a slow but bit of an increase in some people taking hormones still, and they work for people. At this point, it's an individual decision between a woman and her healthcare provider to decide whether hormones are right. If you still have a uterus, you would need to replace with estrogen, but also something called progesterone, which is a way to protect the uterine lining from uterine cancer. So that's two hormones that can either come combined or as separate entities and ingredients. As far as risk of breast cancer, again, in somebody who has personally had breast cancer or uterine cancer or precancerous conditions, hormones really are not appropriate for them. Women who have had migraine headaches with a significant aura, so diagnosed by a neurologist or specialist in this field, those women may have a slightly higher chance of stroke or cardiovascular event on hormone therapy. So that needs to be discussed on an individual basis. Women who have propensity towards blood clot, like those who carry a genetic propensity towards this, and these women know who they are. they are not candidates for estrogen therapy. So that's why we need to have alternatives, because there are, surely people who just can't or won't tolerate hormone therapy. Even though a family history of breast cancer is not a full contraindication to hormone therapy, many women who have watched family members go through treatment and the roller coaster of the breast cancer disease, they want nothing to do with hormone therapy because they're frightened. And that's understandable. So we try to find alternatives.
Yes, and thank you for going through that, because my mom actually had breast cancer. So, it's anything that I can do to mitigate getting it, and doing that, going through hormone therapy. Yeah, not top of mind. So anything that I can do around it, alternative ways, I think, yes, having that option, right?
Yeah,
Having that
yeah.
option, I think is key.
So that brings us to the alternatives. So surely there are other pharmacologic agents like antidepressants, which work for hot flashes.
Mhm.
But a lot of my patients say, but I'm not depressed. Why do I have to take an antidepressant? So we go through the different mechanisms. And for some people, this is very helpful because it does mitigate some of the anxiety or depressive symptoms that might come along with menopause, or that may have already been present beforehand. So this works in some cases, and it's not a forever medication. We speak sometimes about another medicine called gabapentin, which is a neurology medicine that's been helpful for hot flashes, makes people drowsy. So we get people to take it at night, and then they can facilitate sleep. Again, can have some side effects. Not everybody wants to take this, but it's another option in the war chest. And then I'd like to bring up the herbal supplements that are available, because these seem to be really top of mind as first line agents to see if they'll be helpful. Surely Relazin, which is a product from Bonafide, the company that I am the chief medical officer of, is a Swedish flower pollen extract that's been shown in studies to be safe and effective for hot flashes, quality of life, and sleep issues related to menopause. So I can stand behind this supplement. Number 2, we have soy isoflavones. So these are plant-derived supplements that have estrogen-like qualities, but they are not estrogen, and they have been shown to be helpful for some women. So we do have quite a few things in our armamentarium to help with these symptoms.
Perfect. Thank you. So I just want to kind of really quick get into the sex part of it.
You bet.
So, women who are going through menopause or even post-menopause, is sex, is that it for them? Or, and then I guess the second question is, if sex is still on the table and, painful, they have painful or dryness, how can they, go through in a healthy way, go through these symptoms?
Right. So sex is absolutely not over in menopause, but it may need to be worked on a little bit.
Okay.
So again, let's focus on some positives. No longer need to consider or worry about contraception with all the caveats we spoke about. So that's a freedom and a liberation for lots of women. Number 2, freedom from bleeding, which I think any person would say they are happy to be liberated from that issue, especially as it comes to sexual activity. I think it's so important to note that there are so many things that go into the sexual response for women in menopause. And so there's the psychological, the emotional, the physical, the medical, and the hormonal.
Mhm.
So to get quickly to the point that deters many women from sexual relations during menopause is pain and dryness. So estrogen works with this, and there are vaginal estrogen products that don't work systemically and don't necessarily have all of the same risk that systemic hormone therapy have, but creams, tablets, rings, they can work to really help with vaginal dryness and discomfort during sex. Because after all, libido or sexual drive will plummet if you're anticipating pain. So pain has to be managed. Number 2, before getting to hormones, lots of women will just rely on a more conservative program with moisturizers. After all, we moisturize our faces every day. Why not moisturize our vaginas all the time in an effort to maintain elasticity and supple tissue? So there are wonderful moisturizers out there. One that, of course, comes to mind are ones with hyaluronic acid. This is a super duper moisturizer. incredibly helpful for vaginal moisture, and it's non-hormonal, used regularly, comes either as an ovule called Reverie, or there are other gels out there that can be used with hyaluronic acid. Some women use coconut oil. Some women use other over-the-counter products. Again, moisturizing is key on a regular basis. And then lubricants to be used during sex to facilitate so that dryness and discomfort aren't an issue. So we can go from conservative to aggressive and really remedy the issue with pain so that women don't want to avoid sex because it hurts.
Right.
So I just want to bring up something, two things that I just always like to make points of. If you're perimenopausal, you may be starting to experience some painful intercourse. So this is the time to really start using moisturizers and lubricants. But when you're perimenopausal, you still need contraception. So just something to put out there, because if you're having sex and you're still having your period, you can get pregnant. The other thing is relationship stuff. Many issues with sexual drive, particularly, have to do with relationship. If you need a husbandectomy or a partnerectomy, that's not for your gynecologist. That's really more for your couples therapist. So I often refer out for that, but that has a really big association with sexual drive. So I think that's important to bring up. And the other thing is sexual boredom, because when you're maybe with the same partner for 30 years, you got to spice it up a little bit in an effort to, make it novel and make it still exciting. So those are just some salient points that come up in my office quite a bit.
Yeah, no, those are great points because, I hear it, we live it. So it's just to understand that it's not you. It's, could be the situation, and just to assess it each and every time.
Absolutely. And there's an awful lot that goes into this. These are usually very long consultations that I have. Once again, medical health and sexual health go hand in hand. So if there is a medical issue, it needs to be addressed. And sometimes the medications we use to treat medical issues can impair sexual life. So whether it's dryness or low libido or orgasmic issues or whatnot, they can be addressed separately as well.
Perfect. Well, thank you so much for all of this information. And I know that you have a book, you're a podcast. Can you tell us a little bit about both, and then also where to find you and where can we connect?
Absolutely. And thank you for that opportunity. So I enjoy speaking to people that are would-be patients. So my books are geared towards the lay community. My latest book is called The Complete A to Z for Your V. And I think you can understand what V stands for. So it really goes through all gynecologic issues that I've seen through the years, and in a fun, approachable way. I think the best way to get information about me is to go on the Bonafide Health website. That's hellobonafide.com. Tons of information there. Much of the content is vetted by or written by me. So I think that's very helpful and credible. And my own podcast is actually came out of the pandemic and thinking about all of the self-care issues that women were trying to deal with on their own because they couldn't or wouldn't go to the doctor. And so a business friend, partner, and I decided to do a podcast on businesses that have been created to help women manage gynecologic unmet needs. Many of them are incredible entrepreneurs that we speak to who are creating DTC or over-the-counter products that are really helpful for women. So we find it very exciting. I know I do.
Perfect.
And that's called Business of the V.
Yes. I downloaded it, I only listened to once, but it's in my playlist. So definitely going to be listening to them more often. So thank you so much, Dr. Alyssa, for being on here, sharing your wisdom, sharing your knowledge that we all go through. And this is something we need to learn and to understand, especially, a healthier lifestyle through all of this. So thank you so much for your information and everything else. So, and I'll link everything up in the show notes just so everybody knows.
Okay, great to be here. Thank you again.
Thank you. Take care.
Bye-bye.